Tennis elbow hacks. We were talking about 3 quick wins for today. And last week we spoke about how to figure out if you truly have tennis elbow and how that differs from golfer's elbow. This week we're going to get more specific on how to treat your tennis elbow through these 3 quick wins. Some are going to be temporary, some are going to be for longer term. Okay, so pay attention, get your notes out, get ready to kind of write things down. This will be our 3rd video in our series of tennis elbow, and we have one more final one coming up. Stay tuned for more details on that at the end of this call. Okay, if you're watching on Facebook, thanks so much. Be sure to like and comment below. If you're watching on YouTube, be sure to hit that subscribe button as we get started here. So just to start off with this is so important, guys. The research has found a connection between weakness in the back and the shoulder muscles and the development of tennis elbow in males and females between 40 to 60 years old. Okay, that is very, very important. So keep that in mind as we go through these kind of just kind of temporary and kind of longer term relief exercises for tonight and kind of techniques you can use to help reduce your pain and symptoms. We're going to dive into the topic with that being said, and there are 3 quick wins we're going to talk about in detail tonight, or hacks you can call them. Right, number 1 is temporary relief through using a tendon strap or a brace. Number 2 is temporary relief through using a lacrosse ball for soft tissue mobilizations. And number 3 is longer-term relief through mid-back and shoulder strengthening. All right, so let's start with number 1, temporary relief through a tendon strap or a brace. So I don't have a tendon strap or a brace with me, but I'm going to show you using a little bit of kind of a stretching strap here, okay? And I'm just going to show you kind of what it does. So pretty much this is all it is. It's like $20 to $60 on Amazon. You would buy a tendon strap for tennis elbow, and it really just applies compression to that lateral epicondyle around that elbow. So it would kind of apply compression right in this area, right? And I would kind of squeeze it here, and all that does, it takes stress off of the actual epicondyle when those kind of wrist extensor muscles activate. So when you pull your wrist back to kind of activate those muscles, you're going to get a kind of aggressive pulling on that tendon which attaches to the bone. So by applying compression there, it's going to decrease the amount of resistance and force put on it at a point in time. So that's going to help just decrease overall pain and symptoms, and it's kind of really beneficial to wear that throughout the day. Like say you're shaking hands throughout the day, say you're using your arms, you're a construction worker, maybe you work at a desk and you're typing, that's a good time to wear it. You don't have to wear it at rest, just with activity typically. Okay, so usually around 6 to 8 hours per day. So that's number 1, that's temporary relief. Number 2 is temporary relief through a lacrosse ball, right? You can grab one of these on Amazon as well, $2 to $5, right? See if there's a sale, you can get kind of hooked up there. Lacrosse ball soft tissue mobilizations is what I'm referring to. And this, just like the tendon strap, is going to provide temporary relief. These are not going to fix your issues. I want you to kind of make that clear, and I want you to understand that. These 2 things are going to really help decrease your symptoms initially and help you, but you need the exercise component and the manual therapy as well, depending on like which stage of tennis elbow you have. So how does this work? Use a lacrosse ball. You can use a golf ball if you want, or you can use a tennis ball or a baseball, but this tends to work the best because it's like nice and firm, right? You're going to do 1 to 2 minutes of soft tissue work with trying to release those wrist flexors. So most people jam it on the top of the wrist here in those extensor muscles, but we don't want to hit that area. We want to actually hit the wrist flexors, which are all in here, right? So you can see all through here to here. This is the whole area that I want to target, and I want to find a nice kind of flat area so I can use my desk here to put it on. You guys can't see that, but I'll kind of show you here. I want to kind of press down here into it, and I would just kind of roll my forearm along the ball here. Right? Obviously, I would have this pressed against the desk as I'm doing it so I can put good force through it, but then I want to pause on tender areas. So I usually get a little bit of a knot right here in the midpoint, kind of that muscle tendon junction there. So I would apply a lot of compression there, and then what I would do is move my wrist through full range of motion. This is wrist flexion, so I'm actually going to stretch the top when I do this, the wrist extensors here. As I pull down, then I want to kind of stretch the bottom area where my lacrosse ball is as I come up into wrist extension. And I can do that 5 to 10 times and just find 3 to 5 common tender spots or areas that have knots and just go through that and actively release it. That's going to help, again, take off compression there and provide temporary relief to get you through your daily activities without much discomfort. All right, that's number 2. Number 3 is longer-term relief through mid-back and shoulder strengthening. This is what we open up the call with. This is what research really supports. It heavily supports strengthening different muscle groups like your rhomboids, your middle traps, your lower traps, your serratus anterior muscle, your posterior deltoids, and most importantly, your rotator cuff. Mainly your posterior or back rotator cuff there, right? Not really the front area. So strengthening those muscles is really going to help through moderately heavy resisted exercises. right? And it's recommended to start using machines when you start to do these strengthening things, right? Because with machines, you're not doing excessively kind of hard gripping like you would with dumbbells or kettlebells. So it's not going to put as much strain on that lateral epicondyle, and it's going to take stability out of the equation. So you don't have to think about using those other small stabilizing muscles as much when you use machines. And this is just for mid-back and shoulder strengthening, guys, not for wrist and kind of forearm strengthening. So I would do that, start with that 2 to 4 weeks, do 2 to 3 sets per exercise, and do 8 to 12 repetitions, because that's what hypertrophy is based on, and that's where we want to grow some strong muscles and develop good strength from. After that, then you can progress the bands. Bands are going to apply resistance throughout the whole range of motion, which is a little bit different than machines. Then you progress to kettlebells and using dumbbells, even for your wrists and your forearms, because dumbbells and kettlebells are going to exert force straight down due to gravity. So that's going to challenge you a little bit more. It's going to require more stability through those little small stabilizers in the wrist, the forearm, and even in the shoulder joint. So everything plays an important role, but those are the 3 quick wins that I wanted to tell you guys about in detail that have helped me and helped a lot of my patients in the past. Just to recap, number 1 is temporary relief through tendon strap or a brace, wear with activities, 6 to 8 hours a day. Number 2 is temporary relief through lacrosse ball soft tissue mobilization, perform for 1 to 2 minutes with 5 to 10 kind of active releases, moving your wrist through full range of motion. And number 3 is longer term relief through mid-back and shoulder strengthening based on the research, doing 2 to 3 sets per exercise and 8 to 12 repetitions of moderately heavy resisted exercise using machines, then progressing to bands, then progressing to dumbbells and kettlebells. So hopefully that makes sense. Hopefully you guys found that useful. Hopefully you understand the difference between temporary and longer term relief. These things won't fix it, but it will help it drastically. And then you usually need a physical therapist to help you progress these things so you don't progress too quickly or you don't progress too slowly. So they can help you find that kind of happy medium in between. So be sure to like and comment down below if you're watching on Facebook or YouTube. We have free guides below you can kind of check out if you're on our YouTube page. Be sure to subscribe so you don't miss any free tips and tricks as we go through the rest of our tennis elbow month. We have one more video coming up next month, which is going to go through the 2 best exercises for strengthening and mobility for tennis elbow. All right, thanks guys so much and have a great rest of your day.